representing Eastern Europe, Andriy Klepikov.
Colleagues, distinguished delegates and guests. Thank you everyone for coming together at AIDS 2024 and sharing your enthusiasm, dedicated and committed to the HIV response. Since we started AIDS 2024 with the traditional Bavarian dancers in their traditional outfits, it is only appropriate that I, as a local co-chair, also close out this incredible conference in traditional Bavarian attire. Before I go further, I want to thank the activists and communities for your passion on this week. You are the backbone of the HIV response, driving the change. This would not be an international AIDS conference without you. Neither would this be an international AIDS conference without groundbreaking science. And we were certainly not disappointed. Among many other highlights, researchers affirmed that long-acting injectable cabotegravir, or CAB-LA, is a popular choice for women and men on the African continent. People should have the choice of prevention tools, as we've heard in the rapporteur back session. This will help us overcome the changes and challenges associated with having to take a pill every day. Now, we need to ensure that all people, including the most vulnerable in the most affected regions, have access to these innovations in prevention. This is just the tip of the iceberg of the great body of science that we have learned about and explored over the past week. In my home country of Germany, the conference itself drove progress, with the mayor of Munich calling on the state of Bavaria to make drug consumption rooms legal, and Munich becoming a fast-track city on the opening day of the conference. It was wonderful to see the Chancellor of Germany, Olaf Scholz, opening the conference. He reaffirmed Germany's strong commitment to the HIV response and called on us to put people first in the language we use. We need broader political will and funding to translate science into action. Most important is that the latest medical advances must be accessible to all people around the globe. I want to thank the organizers, the entire IAS team, the program committee, my wonderful co-chairs Sharon Lewin and Andriy Klepikov, Germany, Bavaria and the city of Munich, as well as Messe München, for making this amazing conference happen and providing a platform for fruitful exchange. With that, I say, Tschüss und auf Wiedersehen. From Munich and Germany, it has been an immense pleasure hosting you, and I look forward to seeing you again for IAS 2025 in Kigali. Thank you.
Friends and colleagues, distinguished delegates and guests, it has been an honor to serve as a regional co-chair at AIDS 2024. This position allowed me to bring critical attention to my region, Eastern Europe and Central Asia, where so much remains to be done. Ahead of this conference, UNAIDS released its global update, and the news for Eastern Europe and Central Asia was not good. We are not only off track in reaching global goals, but new HIV acquisitions and AIDS-related deaths continue to climb. Instead of making progress, we are rolling backwards. Our success depends on scaling up evidence-based HIV response in the region and opposing Kremlin's aggression against public health and human rights. We cannot end AIDS pandemic without ending it in Eastern Europe and Central Asia. Yet, despite these daunting figures and the massive challenges ahead of us, I am leaving Munich optimistic. This week, I have drawn energy and inspiration from the young people of the AIDS 2022 Youth Force, from vibrancy of the global village, from the passion of protesters demanding that we put people first in every aspect of the HIV response, from the resilience of communities effectively opposing HIV amidst wars and crises, including my home country, Ukraine. I have attended and participated in the sessions focused on my corner of the world and the communities too often left out of decision making. People living with HIV, people who use drugs, sex workers, people in prisons, indigenous communities, and LGBTIQ community. We have spent a week together imagining what the world would be like if we put people first. And as you all return home, let's not forget this world we imagined together. United in this vision, we will end AIDS as a threat to public health and individual well-being.
Please welcome to the stage Anton Basenko. Anton is an ardent advocate for both people living with HIV and harm reduction programs that help people who use drugs counteract stigma and access life-saving treatment. Deeply involved in the programming of several organizations, Anton is chair of the board of the International Network of People Who Use Drugs and board member of the Eurasian Key Populations Health Coalition.
Dear distinguished delegates, dear guests, good afternoon. My name is Anton Basenko. I'm a person living with HIV, with lived experience of hepatitis C. I'm a person who uses drugs, and I'm Ukrainian. First of all, as a Ukrainian, I cannot miss the opportunity to say thanks to all of you for your efforts and support for Ukraine in this terrible time. We saw it. We saw it at the opening ceremony. You came up to express your support and even supported us with donations all the days of the conference. I want you to know, we appreciate it immensely. And we with you, we will definitely win. What is the feeling with which I stand on this stage? I feel incredibly proud to be the voice of the community at the closing ceremony of this important conference. But at the same time, I feel a great responsibility because every word spoken here matters. Because every word can save someone else's life. A little bit about my life, and I think the numbers will be more illustrative. I'm 44. My adolescence and first experiments were in the mid-90s. I started using psychoactive substances when I was 14 and injecting when I was 16. But my first syringe in the harm reduction program I received only when I was 23. And at the same time, I found out that I'm living with HIV and hepatitis C. I had to wait 712 days for my immune system to reach the AIDS stage to finally be eligible and to get my golden ticket to start ARV. And I had to wait 13 years for hepatitis C treatment when my liver almost reached cirrhosis stage. I survived 6 overdoses, 3 direct denials of medical care and 2 job losses due to my status. I lost 3 close friends due to AIDS-related tuberculosis. Could have been imprisoned 4 times. Had over 15 unsuccessful attempts to treat my drug dependence before I became one of the first patients of opioid agonist therapy in Ukraine. As you can see, I'm still alive and standing in front of you, and I'm sure that this was possible because someone, once, in their small workplace or large area of responsibility, put a person first, put me first. We in communities always say we are not numbers, and that's true. But the lives of community people are made up of numbers like I just mentioned. And now imagine that the moment I say this, millions of people from different communities at this very moment are still suffering from their numbers and dying, not waiting, getting rejected, ending up in jail. And all this in 2024. More than 40 years since we know about HIV infection, and just over 5 years to 2030, when the whole world and governments have set themselves the goal of ending the AIDS epidemic. I think we simply have no choice. The time of declarations and beautiful conference title is over. Putting people first is now the sacred responsibility of every government, every policy and decision maker. And it is these people, you are the people. Let me hear you, people.
Yeah!
You, civil society, representatives of all key affected communities who must be included in all processes as full participants and equal partners. There are no other options, because nothing about us without us. I'm from the Eastern European and Central Asia region, the fastest growing HIV epidemic in the world. In the region where one country with the largest territory and one of the largest HIV epidemics in the world, Russia, dragging everyone back to the dark age. By destroying hospitals and killing civilians and kids in my country, and influencing other countries propagating hate through homophobic and drug-phobic narratives and legislation. Well, human rights for key populations in our post-Soviet states have always been poor. Criminalization is a fundamental problem and cross-cutting issue for all communities. In recent years, governments in the region, though we also see it globally, have increasingly adopted laws and practices that restrict civic space, threatening human rights, activists, and placing additional pressure on already marginalized populations. LGBTIQ+ people living with HIV, people and women who use drugs, sex workers, people in prisons, indigenous people. KGB and Stasi methods are back. They are used against my colleagues and activists like myself from Azerbaijan, Georgia, Kyrgyzstan, and Belarus. Just imagine, my colleague from APH, the national coordinator of REACT, Human Rights Monitoring System, and well-known Ukrainian human rights activist Maxim Butkevich, who went to serve and defend Ukraine and our European choice and our European values as a volunteer, was captivated and is being held in terrible prisons in Russia for the 2nd year. Remember this hashtag, Free Maxim Butkevich. We are sure if civil society and community organizations disappear due to political pressure, the HIV response in this region and globally will fail. Community leaders in ICA region are now united with call to all potential allies, and I want you to learn and repeat it with me. Rise and decriminalize. 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 But I wouldn't want to talk only about sad things. We do summarize the results of the conference and try to imagine what's next. We come away with the unique charge of energy and networking that needs to be used to maximum effect. Here is just a small snapshot of what we have seen these days, and as communities consider a priority for future work. Innovations, innovations and innovations. Virtual social workers and other digital solutions. long-acting ARV and opioid agonist therapy, medical-assisted therapy for stimulant user and chemsexers, innovations in fundraising like cryptocurrency projects, U=U, including people who use drugs, PrEP, but not excluding condoms, not disvalue condoms, mental health and well-being, opioid agonist therapy, harm reduction and combination prevention, drug consumption rooms, aging and HIV, sexual and reproductive health and rights programs, co-infections and comorbidities, women and youth-led initiatives, community mobilization at all levels, and of course, stigma reduction, funding increasing, and partnerships building. And all this needs to be scaled up and reach the hardest to reach at cosmic speed. What is important, and this is not the first conference we have heard this, is that we have all the tools in place, we have all the tools we need, but what we don't have is time. And every minute, and as we know, and as we heard here, one person in the world continues to die of AIDS. So I want to rephrase the motto of this conference and call you, put people first now. Put people first right now, immediately. And I really hope that when I attend the next conference with another inspiring title, I will not face a feeling of insurmountable déjà vu because I have already seen and heard all this. And last but not least, my community peer from Uganda who spoke at the opening, he said that he's the first ever transgender man speaking at the opening of this conference. Unbelievable, huh? Well, I don't know if I'm the first ever person who used drugs speaking at the closing ceremony, but I'm sure we must keep doing that to hear and see communities in all their diversity and put them first. Thank you for your attention.
Please welcome to the stage the IAS President and International Chair, Sharon Lewin.
Well, we got to the end. What a brilliant talk, Anton. Thanks very much for reminding us to not just put people first, but put people first now. A brilliant take on a very powerful slogan. Friends, colleagues, distinguished delegates and guests, thank you to everyone who attended AIDS 2024 here in sunny, sometimes rainy, but very beautiful Munich, and virtually from around the world. This has been a historic week for HIV science and the HIV community. I was thrilled to welcome 3 of the 7 people cured of HIV by stem cell transplant, Adam, Mark and Paul, and of course we learned about the next Berlin patient, a German man who appears to be the 7th known individual cured of HIV. And although many scientists are excited about this, we know that stem cell transplantation can only be used in people with other serious illness, such as leukemia. But the case of the next Berlin patient has helped again energise us as we explore cure strategies based on gene therapy and other approaches. It's stories like this that give us, people living with HIV, clinicians, scientists and policymakers, hope. AIDS 2024 also showcased the late-breaking results, which you've heard a hell of a lot about, but they are truly spectacular. The Purpose 1 trial of long-acting injectable lenacapavir for HIV prevention. We all knew it was coming into the conference and that the researchers had announced 100% efficacy in preventing HIV among cisgender women in Africa. And now we know that a twice-yearly shot to prevent HIV could potentially revolutionise HIV prevention. But our community also knows too well that breakthroughs in medicine are only meaningful when the people who need those medicines can access them. So we call on all stakeholders to do everything possible to facilitate access for all, starting with the trial participants and their communities and not stopping there. This week we did what this conference does best, brought together industry, policymakers, advocates and scientists to prepare for this drug's potential approval and rollout. Before I conclude, I'd like to express our heartfelt appreciation to our partners, Gilead Sciences, Merck Sharp & Dohme and ViiV Healthcare for their unwavering support. I also want to thank my wonderful co-chairs, Christoph and Andriy. You are both wonderful and inspiring people, great colleagues, and I have just loved working closely with you both. I'd like to thank the extraordinarily dedicated organising committee for their hard work, brilliant ideas and commitment over the last 2 years, the City of Munich for hosting us, and every delegate for hanging on till the very end and realising this International AIDS Conference's promise of uniting the HIV response. I'd like to make a special thank you to all our fantastic volunteers who came together, stewarded us through the week with a smile always on their faces. And a huge note of appreciation to all